So I wanted to introduce, we have Eric Stowe, who's the founder and CEO of Splash, which undertakes water projects that serve 600,000 children in schools, shelters, orphanages, and hospitals in 7 countries. Welcome, Eric. And we also have Wali Mwalugongo of Fresh Life, who manages Sanergy's contribution to a 5-year USAID-funded program in the Democratic Republic of Congo. Welcome, Wali, as well. So let's go ahead and get started.
Can I
Yes.
call an audible?
Yes.
Okay. Can I get everybody to stand up just for a second? Before World Bank and WHO and USAID leave, my 14-year-old daughter last night asked me, what is it going to take for me to get the wash sector to follow our lead? I just did it. Sit back down.
Completely unscripted.
Yes.
Thank you, Eric. For whoever didn't have their coffee and wasn't awake yet, there you go. All right.
Number one goal is to be a success in her eyes. So
I'm sure you are, especially now. So we're here to talk about localization and WASH, and I've been with Devex now for nearly a year, and as you can imagine, I have heard a lot about localization. I've also come to realize that it is a lot easier said than done. You know, in a lot of ways, you're effectively working yourself out of a job, as many people have said, or at least in the short term, transitioning to a bottom-up approach does impact the bottom line. So, Eric, this is essentially what Splash has been doing. It goes in with an exit strategy for its projects. Can you give us some examples of how that is working, how that is a sustainable business model, and any lessons for other NGOs? Is it supposed to be a sustainable business model? Okay.
No.
We'll start there.
Maybe I'll start front end first. So Splash started in 2007. Since that time, we have opened up in 8 countries and we've exited 6. So that's pretty exciting. In 2018, we launched an initiative called Project Wise, Wash in Schools for Everyone. We did that in 2 key cities, Kolkata in India, Addis Ababa in Ethiopia. And we did that strategically. One, a city with high water quantity, really low quality, Kolkata. One, very low quantity, high quality, Addis. And the stated goal, we had 5 key principles. We wanted to do citywide coverage of every public school in both of those cities. 2, we wanted to do that only with local staff, so we have no expats working with or for us there. 3, we only wanted to use local products. That's a lot harder than you might imagine. 4, we needed and required that government would invest at least 30% of the overall financing for these projects. Again, way harder than you might imagine. And 5, that we had a clear exit strategy, that we weren't going to be there in perpetuity, that we would leave a body of knowledge to show cost efficiency, effectiveness, durability, impact, et cetera, so that this was imitable, that you could actually replicate these projects. We have, since the launch of that project in 2018, we have expanded to an additional city in Ethiopia. And in both cities, we've seen government come in at about 35% financing, which is really spectacular. In India, we did not see that. We saw the local staff, we saw the local products, we had the plan to do the entire city, and we actually had to back out last year when the government was not coming in with the financing that we required. We came to the table with $12 million and said, you need to put in at least 4 to 5, and we just could not flush that cash out of the system. For myriad reasons, pandemic certainly exacerbated that. But in both cases, we wanted to be able to show that you can do this work at scale, that you can do it cost effectively. And that was what we considered phase 1 of Project Wise. And the pros, I think, are many, but the negative is that it was entirely reliant on Splash. So the reason we're up here today is because we're talking about potential partnerships. And as we envision a phase 2, we are in conversations with potential partners in Kenya to basically replicate the same model. Can you do this across 2 to 3 cities to show that it's appropriate, to show the government what the model might be, to show that it's imitable? But in phase 2, we want the INGO to take a back seat. We want us to help with some of the coordination, but really to be able to find partners on the ground that are like-sized, similarly minded, and honestly are mature enough to be able to do this work And I only say it that way because a lot of times the partnerships that we're all talking about, there's the prime and there's the sub. And the power dynamics are significant, right? It's oftentimes small groups like ours drafting in the wake of these big primes. And what we wanted here is we wanted to find organizations that were about the same age, about the same budget. Is there a way that we can take all these collective core strengths, do a similar model, every single public school in Kisumu, every single public school in Mombasa, and have Splash play a very minor role in this process. So getting into and out of Kenya in a 5-year span versus into and out of Ethiopia, where it's all my staff, that's a 20-year project. Maybe I'll pause there, but that's the genesis of this conversation, is how can an INGO play a small mitigating role so that in phase 3 of this work, we're not even needed. So in everything that we're trying to do, we want to have an exit strategy and if not even a death knell of what we are as an INGO and what INGOs should be in general.
Interesting. Wali, I know you've worked a lot in sanitation in various municipalities and cities. So how have you seen localization work in practice on the ground in your experience? But what have also some of the barriers you've encountered?
Great, that's a great question. So at Sanergy, over the last 10 years, we've achieved immense scale, serving about 150,000 people every single day in Nairobi with the container-based Fresh Life toilets. It's not been an easy journey. And a lot of what we've done is coordination on the ground and local partnerships. By local partnerships, meaning, yes, we are speaking to government, but government doesn't get it. They don't live in the urban informal that we are working in. And you have to find businesses in those in that context which get it, who will be the early adopters, partner with them because they understand the situation on the ground. They do understand the challenges they are going through as businesses and also as users. And for the last 11 years, we have seen that that's the best way to even enter a market, foster social behavior change, because people will likely relate to a challenge that they are both facing rather than somebody coming and pushing it to them. So an example of how the Sanergy model works is we make sure that all our employees really come from our own areas of operation. One, because they understand the challenge, they understand what we are trying to solve, they understand the products that we are trying to push for to improve the sanitation situation, and they're able to live it every single day with the people whom we want to be adopting the improved sanitation solutions. Secondly, we have recently been able to scale our operations to 2 other cities in Kenya, so Kisumu and Eldoret. Again, the model was the same. We had to talk to utilities, to government, to be able to understand, as the people who are creating the policies and also regularizing sanitation and improve sanitation as the service provider, to be able to set that enabling environment for that local partnership level discussion to actually work. Because if we went to Kisumu, they don't know Fresh Life toilets. I can't speak to somebody in Kisumu about a Fresh Life toilet because they haven't seen it before. And I need Kiwasko, for example, to be the person saying, we do have a solution for you, other than the sewers that can't reach you, and this is the best solution because we think it's gonna work, right? Similarly to other areas that we have expanded to, we've seen a lot of these local partnerships with local businesses and also improving the supply chain of sanitation products specifically, because it's not just the Fresh Life toilet that the customer needs to use. They need to use water, they need to know where to get soap. And so how do we have that conversation with everybody who is in the water and sanitation hygiene supply chain within the context that we are working in, to work together towards providing a service to this one customer. So that's definitely what I would say is a recommended model to work.
Thank you. Now, And Eric, you had mentioned government contributions. We heard this during this conference, estimates that WASH will need, in order to achieve the SDG, 600 billion to a trillion a year. That's quite a figure. And obviously the private sector here will be key as well as donors and governments in this whole of effort. So I'm wondering, we're also hearing so much, and we're going to continue hearing about this, is WASH tends to be under-recognized both on the political side and on the funding side. How would you approach it to donors or the private sector to show that this is a lucrative marketplace, working with these local organizations?
Lucrative.
Is
No,
viable.
I'm sorry. I'm not trying to be. Yeah. I can't imagine trying to make that case. So in our instance, again, it's 30% is what we're asking for. That should be a hell of a lot more. We work in public institutions. This is the government's responsibility, and INGO should never be playing a role in this. Yet we're coming to the table with 65 to 75% of the financing. So our ability to suggest it's lucrative is just not there. These are public schools serving the poorest kids. It's not a private sector market. There's not an opportunity to make money. The way we try to get the government to come in, we have them fund sanitation and water storage, because those are existing line items. We're trying to put our costs at about 10% of what the government currently funds, which means the quality is lower than what we'd like, but it's the best we're going to get, knowing that government's just not going to come in with a new line item. They're not going to amplify it by 50%. So I could never suggest working in a public school or a public hospital is going to be lucrative. Sorry.
No. I like the honesty. I think a lot of other people do in the audience as well. I mean, just to follow up, your goal is to not have the NGO involved. So do you foresee, though, any kind of role in general? Where do you see, in general, INGOs? Ideally, if they're going to this local model, they still would have a purpose?
I don't know. I don't know. I mean, there's so few examples. I know Water Advocates, Watershed. A few groups have sunsetted before, but it's not the norm. Maybe what I'd just say, what I'm super excited about with the partnership is that I think Splash does a couple things really, really well. Sanitation is not one of them. And so what we were excited about in Kenya is that we've got a partner that will blow us away. Their costs are far cheaper. They're way faster. They're far more appropriate than we will be. Then our second partner actually does nutrition. They do midday meal campaigns in schools, and they're looking at national coverage. So this would be a WASH plus MH plus nutrition play. Then the third partner, Shafco, they focus on community engagement. They're kind of like a one drop in Kenya, where they're really looking at this, how do you engage the community at all levels? And they're really, really good at water. So all of a sudden, Splash can focus on a couple of our core strengths and amplify it with our partners. So I'm just terribly excited about it. We've never been able to work with a partner that's this far along, that they're of this age, similarly sized budgets. I mean, most NGOs, less than 1% ever make it to $1 million annual budget. Less than 1%, 5 million. Less than 1% of them, 10 million. And we're all about that same season. We started around the same time. I've just never seen it in the WASH sector where you've got 4 complementary organizations kind of pushing each other forward. So I don't know how it's going to go, but I'm really excited about it.
No, Wali, I won't use the word lucrative. Do you see a role for the private sector, or, on a different note, how do you convince governments and donors that they should be investing their time and money into this?
Well, that's a great question, and certainly something that we've also been thinking about. And just piggybacking on what Eric has said, I think we all need, as private sector, to start speaking with the same voice, because often we are speaking to the same people in government, and I want to go and sell them Fresh Life. Somebody else wants to go and sell them water. Somebody else wants to go and sell them MHM, menstrual health hygiene. And we are all serving the same customer with all these products. And so I feel like it's going to be a stronger voice if we are partnering together to show government that this can work. And if they're investing in it, if they're the ones picking this up to provide it as a public service, they can actually do all facets of it. And it also becomes easier because as we are speaking to government, we already know that they might have the budgets, but they don't know what to do with them. We are also able to influence that from a collective perspective instead, as opposed to just speaking about Fresh Life toilets only, while the Fresh Life toilet user needs water. The Fresh Life toilet user could also be a girl in school who needs pads, right? And so being able to also capacity build the government to that thinking requires that collective voice, and speaking with one direction, with one goal, is gonna make it a more stronger case than just going single-handedly and working in silos.
So speaking of a collective voice, I mean, we're in day 2 of the UN Water Conference, and it's the first time, as Sarah mentioned, this kind of event in 50 years, a Paris moment, if you will, for WASH, which seems quite ambitious. What are some of your thoughts in terms of what you've been seeing and what you hope to see at the end of this very lengthy action agenda? Which do you think it will be long on actual action? Eric, we'll start with you.
I think we are outside of most of the conversations. I feel like we're being updated about conversations that have taken place. And I think the action on the front end and the action after this are the bookends where all the meat is happening, and we're just kind of being shown the sandwich right now. So I don't know what to say. I heard a lot of updates yesterday, today, and probably tomorrow. But organizations our size are either not in attendance, couldn't be in attendance, or we're on the outside just listening. And I don't want to sound jaded.
No.
That's the space we occupy on the periphery, for sure.
Wali, what are some of your thoughts?
Well, I mean, similarly to Eric, but again, I think even people who are having those conversations without private sector, I mean, they need to start the work tomorrow or by Monday, reaching out to people who are actually doing the work on the ground to understand the context better, and then start figuring out how to foster these partnerships is what will get us there. I believe we are all speaking with the same goal, but in different spaces. So how do we start making an effort proactively to pull all ourselves together to have the same conversations?
Well, you're certainly not on the periphery here, and we're very glad that you came and shared your insights. So I want to thank you so much, Eric and Wali, for this conversation. Please thank them from the audience.